A 65-year-old man presents with chest pain relieved by rest. ECG is normal. What is the most likely diagnosis? A. Unstable angina. B. Stable angina. C. Myocardial infarction. D. Pericarditis. Correct answer B. Stable angina. Stable angina occurs because narrowed heart arteries can't supply enough oxygen when the heart works harder during activity, leading to discomfort. The pain is relieved by rest because the heart's demand for oxygen decreases, easing the strain on its blood supply. A normal ECG taken while at rest is common in stable angina, as abnormalities often only appear when the heart is stressed. His age is a significant factor, increasing the likelihood of narrowed arteries that cause such symptoms. ST elevation in leads 2, 3 and AVF indicates infraction in which area of the heart? A. Anterior wall. B. Lateral wall. C. Inferior wall. D. Posterior wall. Correct answer C. Inferior wall. ST elevation in ECG leads 2, 3 and AVF points to acute injury of the heart's inferior wall, strongly indicating a myocardial infarction in that area, that is heart attack. This is typically caused by a blocked coronary artery and represents a critical medical emergency needing immediate treatment. A 55-year-old with orthopnea and paroxysmal nocturnal dyspnea likely has which condition? A. Asthma. B. COPD. C. Left-sided heart failure. D. Pulmonary embolism. Correct answer C. Left-sided heart failure. Left heart failure causes pulmonary congestion, leading to breathlessness when lying down. Orthopnea and paroxysmal nocturnal dyspnea are classic signs. These symptoms improve when the patient sits or stands upright. A patient with a mid-systolic murmur at the right second intercostal space radiating to the neck most likely has A. Mitral regurgitation. B. Aortic stenosis. C. Pulmonary stenosis. D. Hypertrophic cardiomyopathy. Correct answer B. Aortic stenosis. Aortic stenosis produces a harsh mid-systolic murmur heard best at the right upper sternal border. It typically radiates to the carotids. Patients may also have symptoms like syncope, angina and dyspnea on exertion. Which drug is contraindicated in inferior wall myocardial infarction with right ventricular involvement? A. Aspirin. B. Nitroglycerin. C. Clopidogrel. D. Heparin. Correct answer B. Nitroglycerin. In right ventricular infarction, preload is crucial to maintain cardiac output. Nitroglycerin reduces preload and can worsen hypotension. Fluids are usually given to support circulation in such cases. Which of the following is the earliest sign of cardiac tamponade on echocardiography? A. Right atrial collapse. B. Pericardial effusion. C. Left ventricular hypertrophy. D. Aortic root dilation. Correct answer A. Right atrial collapse. In cardiac tamponade, fluid compresses the heart chambers. The right atrium, being a low pressure chamber, collapses first during diastole. Echocardiography is the key tool to diagnose cardiac tamponade early. A patient has palpitations and an irregular pulse. What is the most likely diagnosis? A. Sinus tachycardia. B. Atrial fibrillation. C. Supraventricular tachycardia. D. Ventricular tachycardia. Correct answer B. Atrial fibrillation. Atrial fibrillation presents with an irregular rhythm due to chaotic electrical activity in the atria. It may cause palpitations, fatigue, or even stroke. Pulse and ECG are important for diagnosis. A patient presents with chest pain, pericardial friction rub, and diffuse ST elevation on ECG. What is the most likely diagnosis? A. Myocardial infarction. B. Pulmonary embolism. C. Pericarditis. D. Aortic dissection. Correct answer C. Pericarditis. Pericarditis causes sharp chest pain that may improve when leaning forward. The pericardial friction rub is a classic finding. ECG typically shows diffuse ST elevation and PR depression, unlike localized changes in MI. Which drug is used to break up clots during an acute ST elevation myocardial infarction if PCI is not available? A. Heparin. B. Clopidogrel. C. Streptokinase. D. Propranolol. Correct answer C. Streptokinase. PCI stands for percutaneous coronary intervention, angioplasty. Streptokinase is a thrombolytic agent used to dissolve clots in acute STEMI when PCI is not available. It helps restore blood flow to the heart. It's most effective when given early after symptom onset. Which valve is most commonly affected in infective endocarditis in IV drug users? A. Mitral valve. B. Aortic valve. C. Pulmonary valve. D. Tricuspid valve. Correct answer Drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.